When a newborn baby is born with some congenital abnormality or anomaly, it is very natural for the parents, for the family to be scared and to worry about this. But there is no reason to worry. Yes, there are anomalies. These can be treated most of the time surgically, and the babies can lead a normal life ahead as if there was no problem to begin with. One such condition is anorectal malformation, when the baby is born with absent anal opening, there is no anal opening, or an anal opening in an abnormal site. Now, this condition can be managed. Today, I am going to talk about this anorectal malformation and female babies. Now, in female babies, the opening you will find to be slightly anterior or in front of its normal opening where it should have been, or the opening can be somewhere deep in the introitus or lower part of vagina. Now, this is called a low anorectal malformation. This can very well be treated by a single surgery, which is usually done. It can be done at birth also, but preferably done by 3 months of age. When the tissues are slightly grown, the sutures hold better. In simple language, we move that rectum, which is opening in an abnormal position, to its normal anal position and fix it well and properly in the muscle complex so that this baby has complete continence for future life. She can void, she can pass motions normally, and she can control motions as well normally. 99% of the cases are low ARM in female ARMs and can be managed surgically completely. Now, some 1% female child may have a high anorectal malformation where this anal opening is not in the normal place and it is opening somewhere higher up in the vagina or even higher than that. In which case, yes, surgery is possible, but a staged surgery is required, where in stage 1 we just do a stoma, colostomy, where the stoma is brought out and the baby passes motions from the tummy. Then the second stage surgery, or the main surgery, the major surgery of placing the rectum in its normal position. And the third stage is closure of this colostomy. Now, these 1% babies may or may not have a normal muscle complex. If they have a normal muscle complex, then yes, they are continent, they can control their stools, and they lead a normal life ahead. But some babies don't have their lower part formed well, so the muscle complex may not be formed well, in which case, even after surgery, the continence can be an issue. Now, in the child, when we operate, our first motive is to allow the baby to pass motions normally in the normal position. For the incontinence, there are certain other surgeries which can be used to make the child continent, or to make the child pseudo-continent. Certain enemas or mace surgery can be done later. My message: if your baby girl is born with some congenital anomaly like anorectal malformation, please do not panic. Seek the right medical advice. Go to the right surgeon who will do the most appropriate surgery so that your child is normal and continent